Deserted shopping malls, beaches, arts venues and icons. An Easter long weekend like no other.
There's no place in the world I'd rather be than Australia at the moment.
The numbers tell the story. More than 6,200 cases have now been confirmed, but it's the downward trend of new cases that's giving authorities reason to be optimistic. After a massive spike in March, driven by returning travellers, the number of new COVID cases being reported has fallen dramatically to fewer than 100 a day.
Our public health response has been exemplary.
Keeping apart, closing the borders and clamping down on clusters has flattened the curve and kept community transmission low, leading to the inevitable question, how long will Australians be forced to live like this?
The Australian people are prepared for restrictions for as long as it takes.
Around the world, where the outbreaks have been far bigger and deadlier, governments have begun to relax restrictions and lift lockdowns. But in some cases, it's backfired.
If you look at Japan, if you look at Singapore, they both thought they had great success, and now they've seen a second wave of cases.
Pleading for patience, the government's now giving Australians a chance to use self-isolation for some self-improvement.
Rather than binging on Netflix, to be able to binge on studying.
Cheap, short-term courses are on offer as part of the latest relief package, this time for universities. The government's also guaranteeing $18 billion in grant funding.
Putting a ballast into the university sector.
No relief though for international students, some now turning to charity just to get by. There's no guarantee a vaccine will be found, meaning there's no simple answer to the question of when life will return to normal. The Prime Minister's consistently said the restrictions would remain in place for 6 months. The borders are likely to remain shut for even longer. But behind the scenes, National Cabinet is beginning to chart a path out of this crisis and what a gradual easing of restrictions might look like.
There is a huge risk in doing so, and we've certainly said that it's not the right time now.
A wrong move could prove disastrous. Jane Norman, ABC News, Canberra.